Hi, Chris Popper. I'm here with Dr. Steven Kassels from Boston and also Southwest Harbor, and we're here at the Acadia Family Center in Southwest Harbor. Doctor, just tell us a little bit about your credentials. You're a medical doctor specializing with people with addiction.
Well, my board certification initially was in emergency medicine, and then I morphed my career and became board certified in addiction medicine. And the reason for that was that sometimes up to 50% of people who presented to the emergency department were there related to the disease of addiction.
All right. Why is a facility such as the Acadia Family Center here in Southwest Harbor so vital to the island and to the community?
If you look at the disease of addiction as a bio, psycho, and sociological illness, all three components need to be treated. Acadia Family Center understands that. Unfortunately, there's been a cutback in funding, and a lot of the treatment centers in Maine and even here on Mount Desert Island have had to close, and which has put an additional burden and stress on the funding and resources of Acadia Family Center. And without Acadia Family Center, where would people go? So it's just essential to continue to maintain Acadia Family Center, which does a fantastic job as an integral part of the community.
As a physician specializing in addiction, you know that there's not just one modality to treat people with addiction.
Well, the disease of addiction needs to be looked at no different than a pneumonia. There's no one antibiotic to treat all pneumonias. You could look at it and relate it, and in some ways I think there's a lot of similarities with other chronic illnesses like diabetes. A person may need insulin for diabetes, but if they lose weight and they exercise and they follow their diet, they may no longer need insulin, and
You're talking, okay, go ahead.
Well, I wasn't referring to anyone in particular. But having said that, you may be able to get them off their insulin and put them on an oral agent, a pill. Sometimes they can come off completely. And so the bottom line is there's no magic cure for any chronic illness, but we need to address the disease of addiction from a psychotherapeutic point of view. Sometimes 12-step programs are really effective with some people. The behavioral component, individual and group counseling is important, but there's a certain segment of our population who have the disease of addiction who are in acute withdrawal. Their bodies are not functioning normally, and you can't really capture them and achieve what you want to from a behavioral modification point of view while they're in acute withdrawal, and that's where medication-assisted treatment like buprenorphine and methadone come in.
Go back for a second.
Sure.
Addiction is a chronic illness.
Correct. And there are a lot of people who don't want to think of the disease.
I mean, people can say, oh my God, you're addicted, it's just a weakness, you should be able to toughen through it and carry on.
The mind over matter issue. Let's pretend for a minute that addiction is not a disease. I believe it is. There's genetic predisposition. The Swedish studies have shown this, or the Scandinavian studies, I should say, from years ago. But let's pretend it isn't initially. But let's pretend heart disease isn't an illness or a disease initially. If you eat poorly, if you smoke cigarettes, if you start to use heroin, if you drink alcohol, there are body changes. And with that, there's disease or there's changes in the organs, the brain, the liver, the lungs if you're smoking cigarettes, for example. So it becomes a disease. So whether you want to think about it as a genetic predisposition as a disease, or whether you want to think of it as a non-disease and it's mind over matter, once people start using a substance, alcohol, cocaine, opioids like heroin, it becomes a disease. And in fact, if you look at the brain, the areas of the brain affected by cocaine, alcohol, and heroin are all in the very similar area called the ventral tegmental area. It's really fascinating, actually, how closely aligned the addictions are.
The importance of medicine or treatment to augment counseling and things like that. If people are dealing with the addictions and the difficulty in getting off whether it's drugs or alcohol, you've got to let the body rest, and you've got to be able to, treat the body before you can treat the addiction. Or am I wrong?
Well, no, I mean, treating any disease is not just treating with medications, but the behavioral modification is important. Exercise is important. Other modalities like acupuncture may be helpful. Exercise, not having a sedentary position. I mean, all of that is really critical to treating from a holistic point of view. But to exclude one portion of treatment versus another doesn't make sense. We need to individualize care, and we need not to stigmatize those people who need some medication-assisted treatment. And if I just could say, President Kennedy, for example, had Addison's disease, and his body could no longer produce steroids from his adrenal cortex, which sits on top of the kidney. So we gave him steroid replacement therapy. We didn't say, oh my God, he's on steroids, just like the football players who are abusing steroids. And we need to think about the same thing when we're talking about the treatment of opioid dependency, heroin addiction, with buprenorphine or methadone. It's the body no longer producing or no longer processing in the normal and natural way the internal endorphins, which are an opioid.
I guess the other way to look at it is if a premenopausal woman has a hysterectomy for medical reasons, they're going to give her estrogen.
Well, that's a great point. And so that's medication-assisted treatment. And again, it's replacing what the body is no longer producing and or no longer processing appropriately.
Okay. Tell us why, the camera's yours, why you should support the Acadia Family Center here in Southwest Harbor.
Well, the simple answer is that without the Acadia Family Center, people would have to go off island for treatment, number one. But number two is, and probably the most important, is the staff at Acadia Family Center is so dedicated to what they do and is so knowledgeable and has so much experience. And they do a fantastic job. And I've worked in treatment centers all throughout New England, and there's no better treatment center than Acadia Family Center, and I mean that from my heart. And I have no vested interest in Acadia Family Center except to say that I know the type of work they do, and I'm really proud to be associated with it.